Hi, Dr. Frege here with Ideal Health and Wellness, and this week I am 28 weeks pregnant, which means I had to take the glucose tolerance test. So not my favorite because I don't like drinking the drink. It always makes me feel nauseous, but got through with that, so hopefully the results will be good. But I thought it'd be a good opportunity to talk about gestational diabetes and what we can do during pregnancy to help prevent it. So typically gestational diabetes develops later on during pregnancy. It can happen as early as week 20, but typically it is even past that. So around that 28th week is a normal time to get tested for gestational diabetes. And what they'll do is they'll have you drink that glucose solution, and then within the hour they will test your blood. Anything above 140 for a blood glucose level is considered abnormal. And again, your doctor would further educate you on how to address that. Most likely you're going to be then doing a 2-hour glucose challenge where they will have you fast overnight. They'll draw your initial one. And then they'll do that too. It's usually a 2 or a 3 hour. We will drink the glucose solution, and then they'll test your blood every hour for those 2 to 3 hours for that. And if that comes back normal, they're not concerned. If that's abnormal again, they're looking at usually having you do the glucose strips. And they'll have you monitor usually about 5 times throughout the day. And it depends on the person. Otherwise, if that's not working and we're not being able to maintain it, and they're seeing that throughout the day, it's just not being well maintained, they might looking at doing insulin injections. But they say, I think, usually about 10 to 20% of women need to actually be treated. Gestational diabetes is hard to initially screen for in terms of signs and symptoms because during pregnancy you don't have a lot of those that you would maybe if you weren't pregnant and had signs and symptoms of diabetes. So that's why the screen is very important. If you have gestational diabetes, again, it's important to have that monitored and or treated if needed because it can cause issues for baby. So baby can be a little bit bigger, which will increase risk for C-section. It also increases risks for baby to be hypoglycemic after birth or the blood sugar being too low. So it's important to monitor baby's blood sugar as well after birth because if it goes too low, baby could have seizures. So again, there are some complications associated with it. If you're diabetic, if you have family history of diabetes, that does increase your risk for gestational diabetes. And again, something that you would also increase your risk for diabetes after giving birth as well too. It's important to maintain a healthy weight during pregnancy to help prevent this. So I know the old saying is you're eating for two. What we're finding is that's really not the case. Really your caloric intake in comparison is not as much as I think women think. So usually in that first trimester, we don't have to increase any calories. Second trimester, we can increase by about 300 to 350, which would be like a snack. A serving of oatmeal, again, would be equivalent to that 3 to 350. And by the third trimester, we can increase to about 400, 450. For some women, depending on your size, that can also go up to 500 calories a day. Most of our increased calorie intake happens after birth if you're nursing, is where that kind of comes into play. So again, just maintaining a good healthy caloric intake, making sure that you're exercising 30 minutes a day for at least 5 days a week so you don't have excess weight gain during pregnancy. Having a healthy weight prior to becoming pregnant is also important and preventative for gestational diabetes. Diet should be high in fiber, lean proteins, and lower in the sugar and the carbs as well. Also eating more small frequent meals throughout the day, so eating every 3 hours or so to help maintain insulin levels. And I'm not talking about candy as a snack, but we want to pick things again that have some sort of fiber or protein. So like a vegetable and hummus is a great snack. 10 to 12 almonds is also a good option to be choosing. So again, just maintaining healthy weight during pregnancy is healthy for mom and baby and reduces your risk for gestational diabetes.